How is the IPI used for lymphoma prognosis? Imagine having a tool that helps doctors predict how well someone with aggressive non-Hodgkin lymphoma might do over time. That tool is called the International Prognostic Index, or IPI. It is a simple scoring system that looks at 5 key factors present at diagnosis to estimate a patient's outlook. These factors include age over 60, which is linked to a slightly lower chance of survival, and elevated levels of a substance called lactate dehydrogenase in the blood, which can indicate more aggressive disease. The stage of the lymphoma also matters. If the disease has spread to areas beyond the lymph nodes, especially in stages 3 or 4, the prognosis can be less favorable. Performance status is another factor, which measures how well a person can carry out daily activities. A score of 2 or higher suggests the disease is impacting daily life significantly. Lastly, if the lymphoma involves more than one extranodal site, meaning outside the lymph nodes, this also adds to the risk score. Once these 5 factors are assessed, each one adds a point to the total score. The total score then helps categorize patients into different risk groups. For example, a person with no risk factors or just one is considered low risk, which generally correlates with a higher chance of survival over 5 years. Those with 2 risk factors fall into the low-intermediate risk group, while 3 factors put someone in the high-intermediate risk group. If 4 or 5 factors are present, the patient is classified as high risk. These categories are useful because they give a rough idea of the likely outcome and help guide treatment choices. The IPI has been around for many years and was originally developed before some newer treatments became common. Today, variations like the revised IPI and the National Comprehensive Cancer Network (IPI) have been created to improve accuracy, especially with modern therapies. Despite these updates, the original IPI remains a valuable tool for doctors to assess prognosis at diagnosis, decide on treatment intensity, and identify patients who might benefit from clinical trials. It is important to remember that the IPI is just one piece of the puzzle. Every patient is unique, and prognosis can vary based on many individual factors. Always consult with healthcare professionals for personalized advice. The IPI helps make sense of complex information and supports better treatment planning, but it does not determine individual outcomes on its own.